Your vagina is very itchy, and no matter what you do, you can't seem to get your hands off there. You just want to scratch and scratch and scratch. The irritation is so intense. It feels like your vagina is on fire, and you have this white vaginal discharge that looks like cottage cheese or milk card. Normally, we use a combination of antifungal medication. We have an antifungal cream that you are supposed to apply. We also use these vaginal pessaries. Oh, before I forget, today I come bearing gifts. You just need to keep watching to find out what Dr. Raisha is giving you today. In this video, I will be answering the questions: what is vaginal thrush? What are the symptoms of vaginal thrush? How to treat vaginal thrush? And how to prevent yourself from getting vaginal thrush. Hello guys, my name is Dr. Raisha, and this is the fertility series with none other than Dr. Raisha. And today we have a very interesting topic. I call it interesting because I have realized that many women are suffering from vaginal yeast infections but are ashamed of seeking treatment because they think that if they do, we will start saying, you are dirty, you are promiscuous. But hey, vaginal yeast infections are quite common among women and they are not sexually transmitted. Actually, the statistics say that about 75% of women will experience at least one episode of vaginal yeast infections in their lifetime. They also say that approximately 40 to 45% of women who experience a vaginal yeast infection will have 2 or more episodes in their lifetime, and around 5 to 8% of women suffer from recurrent vaginal yeast infection. This means that they suffer from 4 or more episodes in 1 year. Vaginal yeast infections are most common among women of reproductive age, with most women getting them from age 20 to age 40. And that takes us to the first question: what is vaginal thrush? You will be surprised when I tell you that right now, as we speak, we have some bacteria and fungi living in your vagina. And basically, that is home to them. Yeah, but they are in very small amounts and they do not cause a problem. The organism of interest in this case is called Candida albicans. It is like an opportunistic organism in that normally it is like,
we will live in your vagina, but we will not cause any problems. Actually, you will not even know that we are.
And we are like, okay, all right. But when you provide it with the right conditions, they forget the agreement and overgrow and they come out to play. And now this is when we get vaginal thrush. So basically, vaginal thrush is the overgrowth of Candida albicans inside your vagina. So what are these things that will make the Candida albicans decide to overgrow? The first one is estrogen. High levels of estrogen promote the growth of yeast, and that is why it is very common in pregnant women or women on some birth control pills. Also, women with poorly managed diabetes, the high sugar levels promote the growth of yeast. Another thing is that use of antibiotics could kill the bacteria inside the vagina. These bacteria keep the yeast in check, but killing them now allows the yeast to overgrow. Another thing is overwashing the vagina using some scented products, douches, or antiseptic wipes. This could disrupt the vaginal pH, creating the perfect condition for yeast to overgrow. How do you know that you have vaginal thrush? The most common symptoms is vaginal itching. So you get the itching on the labia, that is on the lips of the vagina, and on the vulva, that is where the hair grows. So it is on the surface, not inside the vagina. But this itching can be very intense and disrupting. Remember I said that most women get thrush at least once in their lifetime? So even as doctors get it, and believe you me, I know what I am talking about. The itching is so bad. When you are alone, you just can't seem to get your hands off there. You just want to scratch and scratch and scratch. But imagine you are at work or in the streets. Have you seen these memes of women caught off guard scratching down there? I bet they had vaginal thrush and couldn't hold it any longer and are like, I beg, Let me just scratch. Another sign is a white vaginal discharge resembling cottage cheese, or rather like milk card. But we have these women who don't get this discharge when they have thrush. But when the doctor does a vaginal examination, they will see it on the vaginal walls, but it is not too much, so it does not come out. Vaginal thrush also leads to soreness on the vaginal area. This leads to redness and cracks on the vaginal lips. Also, you could get dysuria, which is pain during urination. So when you urinate, the urine touches the cracks and the sores on the vaginal lips, and hence you will feel the pain. There are some healthcare workers that when you mention pain during urination, they just decide that is a UTI and they give you some antibiotics. Now, what does this do? You don't have a UTI. The antibiotics go ahead and kill the good vaginal bacteria, and this worsens the vaginal yeast infections. That is why I always advise that the best way to diagnose a UTI is to get a urinalysis test first. Another symptom is pain during sexual intercourse, but the pain is superficial, like you feel it during penetration because of the soreness on the surface. But once the penis gets in, there is no pain on the inside. How do we now go ahead and treat vaginal thrush? Vaginal thrush can be treated with over-the-counter drugs where you just walk into a pharmacy, explain your signs to a pharmacist, and they will give you some drugs. Normally, we use a combination of antifungal medication. We have an antifungal cream that you are supposed to apply on the vulva, the lips of the vagina, and also the area between the anus and the vagina. This helps relieve the itching. We also have a cream that you can insert inside the vagina. It comes with an applicator and instructions on how to apply. We also use these vaginal pessaries. A pack could have 1 pessary, 3 or 6 depending on the dosage, and you are supposed to insert them into the vagina, not swallow them. The best time to insert is at night as you resume to bed. We can also use some oral medication. An example is fluconazole, which is a single dose tablet that you are supposed to take and you are good. But I do not find it very effective on its own. And if you are pregnant, you should avoid fluconazole by all means. Many people ask if their partner should also get treated. This is a bit controversial because most studies say that there is no need to treat the partner, but some doctors actually say there is need to treat the partner. For me, I would say that if the partner is showing no symptoms, then there is no need to treat it. Remember, candida lives on the skin, the mucous surfaces such as the mouth, the vagina, and the gut, and unless it overgrows, it does not cause a problem, and also it is not sexually transmitted. This takes us to when should you see your doctor? Ladies, you need to visit your doctor if you have diabetes and keep getting recurring vaginal yeast infections, if you are pregnant, and if you have recurring vaginal yeast infection, that is 4 or more episodes of vaginal yeast infections in 1 year. How do you prevent yourself from getting vaginal thrush? Number 1, avoid misuse of antibiotics. We have talked about how antibiotics can lead to vaginal thrush in some women. I am not saying that antibiotics are bad and that you should not use them. No. What this means is don't use antibiotics anytime you feel sick. Maybe you have a cold, joint pains, headache. No. Only use antibiotics when you have a prescription from your doctor. Also, avoid the use of scented vaginal products, douches, and antiseptic wipes. As we said, they disrupt the vaginal pH, increasing your risk of getting thrush. I have made a very detailed video on how you should wash your vagina, so please make sure to check it out. Another thing is that when you go to the toilet, when you go to the toilet, wipe from front to back, not from back to front. Remember, the anus is back there. And when you wipe from back to front, you are carrying the bacteria living inside the anus to the vagina. And this can lead to infections. Also, avoid wearing damp panties. We used to do this thing back in primary school. You have 4 panties, you have lost 3, now you have just 1. So every morning, you have to dry it with a towel. And lastly, wear breathable cotton panties and ensure that they are not very tight on you. And now, I told you I have something for you. We have a vaginal health workshop coming up. Are you struggling with stubborn, recurring vaginal yeast infections and bacterial vaginosis? You have this fishy odor that does not want to go away. You want to learn how to maintain your vaginal health, including expert advice and feminine hygiene tips. Then this workshop is for you. And guess what? It is completely free and it will be on the 31st of this August. So don't wait any longer. Click the link on my description box below and register now. The seats are limited and you don't want to miss. If you have this fishy odor coming from your vagina and are wondering how to get rid of it, then I am going to leave that video over there. But don't click on it just yet. Make sure you subscribe if you want to learn more with Dr. Raisha. Okay? See you over there.